The influenza virus has two big subtypes. One is the A, the other is the B. The A has further subtypes, and the predominant strain that is going around this season is the H3N2. Now, this particular strain is not a new strain at all. It has been there for a while. We know about it, and in fact, it caused a big epidemic back in 2003. Now, the good part about this is that because we knew about this virus, the vaccine has this particular strain included in it. So people can get protected. It cannot be emphasized enough as to how important it is to vaccinate, because this is a completely preventable disease. Nobody has to die from it. And it's as easy as taking a shot to make sure that you are protected. There are a few myths about the flu shot in general. The biggest myth is that I got the flu from getting the flu shot. Now, that is a myth. It has no data behind it. There is no evidence to suggest that it does. And there's a very simple explanation to that. The flu shot is a dead coating, is a coating of the virus. It's not even the virus itself. So in layman terms, it is a coating of the virus, or rather the protein of the virus, that we inject into the patient, and the body sees it as a foreign substance and develops immunity about it. Now, when the virus actually comes in, it has the protein or the coating on it. So the body recognizes that and attacks it, thereby providing the immunity. Now, so as you can imagine, a protein or a coating should not cause the flu. Now, why do people get the flu when they have the flu shot? The reason is it takes about 2 weeks for you to develop your immunity. Now, if somebody has protracted the flu, unfortunately, in that time period, and they were incubating that virus while at the same time they got the shot, that virus manifested itself as the flu and had nothing to do with the flu shot itself. So that is the biggest myth out there. And unfortunately, it has taken such a strong hold that it is very difficult to make people realize otherwise. Yeah, the general precautions apply. It is spread by droplets, meaning that if it is airborne. If somebody sneezes in your face, or if they had come in contact with the person who had the flu and then they didn't wash their hands, or the person who has the flu didn't wash his hands and you got around to it, that would be the common way of getting it. So the best way to prevent or protect against each other is to stay away from those people who have the flu. No children should visit them, and I'll talk in a little bit about who are the the people who are more than likely predisposed to this. So hand hygiene, wash your hands. If you have to sneeze or if you have to cough, put your hand around yourself and just cough and sneeze in your elbow, so to speak, and stay away from crowded places. Especially those people who are vulnerable to this should stay away from crowded places. The peak of this season has yet to come. We are 5 weeks into what most likely will be a 12-week period of epidemic intensity of this season. So we are not at the peak. So the precautions have to be continued all the way up to the end of February and even up to March. And of course, CDC will keep us updated as to how long we will have to do that. But it appears that we will be needing to be careful about this up to the end of February or early March. Now, who are those people who are actually vulnerable to this? So again, the past flu seasons have shown us, and this is no different in that respect, that the young children and the elderly, the pregnant women and the asthmatics, and the obese people, they are the 5 groups of people who are really more vulnerable to this flu than the general population. Again, there will be outliers in every case, but these 5 set of people definitely need to get vaccinated, because if they don't, they are more than likely may get the flu, and if they do, then it will be more severe in them compared to the general population as well. We take our lessons from the H1N1 epidemic in 2009. Had a lot of asthmatics, obese, pregnant females that got sick and got sick really fast and ended up in the ICU. So again, I can't really emphasize it enough. This is preventable. We know this is a known commodity. We know who it is. we have the protection against it. So it would be very um, unfortunate if somebody didn't get vaccinated and got the flu out of it.